3% of the U.S. population has diabetes, and both type 1 and type 2 have many of the same signs and symptoms. Here's Dr. Nidhi Jain with more in today's St. Vincent Corner Clinic report.
Diabetes is a condition that's caused by too much sugar in the body, and insulin is a hormone that's produced by the pancreas, and that keeps the levels of glucose normal. And diabetes is caused by either the lack of insulin or resistance to the action of insulin.
Let's start off with what causes diabetes.
Type 1 diabetes, which presents in children, teens, and young adults, and to a lesser extent in older individuals. Type 2 diabetes, which is the more common form of diabetes, and that generally presents in older individuals. And then the third kind of diabetes is something called gestational diabetes. That's diabetes that develops in pregnant women who have no prior history of diabetes.
Risk factors. Who's at risk of developing the disease?
All overweight individuals, people with a strong family history of diabetes, some ethnic groups like Hispanic Americans, African Americans, Asian Americans, and Pacific Islanders.
Any symptoms that you should watch out for?
Type 1 diabetes presents more dramatically. The symptoms are more acute, but if it's type 2 diabetes, for the most part, it's asymptomatic, meaning you have no symptoms whatsoever. If you were to develop symptoms from diabetes, there would be excessive thirst, more frequent urination, fatigue, weight loss.
Treatment options for both type 1 and type 2.
Type 1, the only thing they need is insulin. They need insulin from the time of diagnosis to the rest of their life. Type 2 diabetes, the treatment can depend. The treatment will depend on this. The treatment will depend on your blood sugars. If you present with very high blood sugars, the doctor may consider using insulin. But if you're in your early stages of diagnosis, oral medications might work.
And if left untreated or not managed well, what are possible long-term complications?
Diabetes is the leading cause of blindness. It's the leading cause for kidney failure in the United States. It's the leading cause for non-traumatic amputations, and the major cause for heart attacks and strokes.
Having a family member with diabetes can increase your risk of developing type 1 by 5% and developing type 2 diabetes by more than 30%. Also, being overweight can increase your risk of developing type 2 diabetes more than 90 times. For today's St. Vincent Corner Clinic report, I'm Jancy Sheets.